Your Eye on Health tonight is live, and we're going to talk about children with high blood pressure. They could face a higher risk of deadly heart disease decades later. There's a new study from Northwestern University that found that high blood pressure in kids as young as 7 could increase the risk of death by 40, even 50% by the time they hit their mid-50s. The findings really do underscore that regular blood pressure screenings are critical even for our children. So we want to take a closer look at the guidance and how we could manage and prevent that. The American Heart Association and the American College of Cardiology released that new guidance together. And tonight we've got Dr. Jimmy Widmer with Baylor Scott White here to explain. Thanks so much for being with us.
Thanks for having me. I appreciate it.
Of course, the first thing I want to ask you, just from your standpoint as a doctor, what was your biggest takeaway from that guidance that they released?
Sure. So this is a really important topic. And the biggest take home from this guidance is that high blood pressure is the most prevalent and modifiable risk factor for cardiovascular diseases. You know, we think about things like coronary artery disease, heart failure, atrial fibrillation, stroke, but also the impact that it has on other areas of health, like brain health, cognitive decline, ultimately resulting in certain types of dementia, as well as the effect that it can have on kidney disease. And so getting control of blood pressure is really critical for all facets of health.
Yeah, it connects to so many other things.
Absolutely.
And I like that you said it's modifiable. If there are things you can do to change it. So if you're at home and you're sitting watching this, what are the guidelines for me in terms of what I should know my blood pressure to be? I know a lot of the times the nurses or doctor will read the number off and you'll say, is that good or bad?
Right.
You have no idea what the range should be. What should we be looking for?
That's a great point. So the American Heart Association and the American College of Cardiology define a normal blood pressure as less than 120 over less than 80. Okay. So just to give you a frame of reference. Now that changes slightly when we're talking about our target goals for treatment. So in a patient who we have already established a diagnosis of high blood pressure, that target's going to change a little bit, and our goal is going to be less than 130 over 80.
Okay. All right. Write that down, you guys. Write that down. Okay. Blood pressure and brain health, because you talked about this affecting other facets of our health. What is that connection like, and how can we keep those two healthy?
Absolutely. Well, so we know that high blood pressure affects, as you already mentioned, all organ systems, and the brain is no different. And so that's one of the reasons that these guidelines really place an emphasis on early identification and management of high blood pressure so that we don't have some of the long-term consequences of long-term uncontrolled high blood pressure and the long-term effects that it can have on brain health, again, resulting in some cognitive decline, even dementia down the road.
Which may not even think about that, but again, it's all tied. Okay, I mentioned going to the doctor and getting your blood pressure checked and knowing what that number is supposed to be, but what if I want to make sure that at home my blood pressure is in a healthy range? What can I do to keep track of that?
Well, you know, blood pressure is variable. And so one of the main things to remember at home is consistency is key. All right. So when you're going to check your blood pressure at home, what I talk to patients about is, first of all, find a good chair. You have your back supported, your legs supported, and you'd like your arm at or near heart level. All right. You're going to sit down for 3 to 5 minutes.
Okay.
Try to relax. So that means putting away the phone.
Yeah.
And you know, you don't want to be finishing your 3rd cup of coffee as you're hitting the go button on your blood pressure cuff.
Sure.
So no caffeine within about 30 minutes, no exercise within about 30 minutes, sitting, resting, and then take your blood pressure. And then what I talk to patients about is wait a minute and then do it again.
Okay.
So we have 2 different readings. Write those down, and then the patients will get those to me, and I'll be able to review not only day-to-day variations, but also have an idea long-term or from a long-term perspective of what their blood pressures are doing.
Sure, and maybe how they're performing in certain situations, right?
Absolutely.
Okay, day-to-day, really quickly before I let you go, what should I be doing if I'm watching this at home, and for me too, just to make sure that our blood pressure stays healthy? What
Absolutely.
should we be doing?
So I want your viewers to remember this. Lifestyle interventions can have a significant impact on blood pressure management and ultimately control. Simple things like weight control, getting a good diet, low in sodium, high in fresh fruits and vegetables, and then also making sure that we're getting that 150 minutes of moderate intensity aerobic exercise spread out over the week.
There you go. It's not me. The doctor says, okay? Doctor says. Thank you so much.
Absolutely.
Dr. Widmer for being with us, Baylor Scott and White. Remember, you can catch up on all of our Eye on Health segments right now on our CBS Texas YouTube channel.